In your shoulder, it could be caused by a rotator cuff injury, and that's actually a specialty of Dr. John Young's. He's an orthopedic surgeon affiliated with Brookwood Baptist Medical Center. Dr. John, we appreciate you being here this afternoon. So we were just talking in the commercial break. How does someone who's out there watching right now know that they have a rotator cuff injury as opposed to just, I lifted something heavy yesterday, I'm having some soreness for a few days?
Yes, ma'am. Usually to get a rotator cuff injury, it would take a pretty good mechanism. A fall on an outstretched arm, really pulling on something really hard that you felt a pop or it was very painful and hurt. And usually the pain doesn't just go away as compared to a sore shoulder overuse type injury where you take some Advil or leave a couple of days and you get better. Usually these persist. One of the more common symptoms we hear is ongoing pain at night, and difficulty working above your head.
So lifting your hands above your head, reaching for high things
Yes.
above you. And you were also saying this is not necessarily something you see in young athletes. This is maybe something you see in, you said middle-aged athletes,
Yes,
or
ma'am.
people who have a serious injury, correct?
Yes, ma'am. Certainly we see it in someone with a big injury, but we see it in a lot of the more middle-aged, real competitive athletic people that do like Tough Mudders and some of these adventure races.
Yeah.
We see it in that, and so that's who we see it in. And usually those are the symptoms, though: pain at night and difficulty reaching above your head.
And obviously there are different therapies. You can go through physical therapy, acupuncture. I know a lot of stuff is out there, but when do you know that those treatments are not going to cut it anymore and you need to go into something more serious like a surgery?
Right. Most people have already tried anti-inflammatories or given it time. A lot of times if we see them in the office and if it's not a convincing rotator cuff tear, we'll treat them with anti-inflammatories. We'll treat them with possibly physical therapy, and usually we'll inject the shoulder with cortisone. But if they fail to get better, and usually the people that really have a tear, they come back or they let you know that that did not help, or that just did not get rid of my symptoms, then that's when we'll usually work them up, and usually we'll do an MRI to determine it 100%.
And to determine which type of surgery they would need,
Yes,
correct?
ma'am.
So I know a lot of people at home might think, oh my goodness, that's what's been going on with me. I
Yeah.
thought it was just, you know, old age, or I thought it was just maybe I've been picking up too heavy of things.
Right.
If they have more questions about rotator cuff injuries and treatment methods, how can they contact you all?
Yes, ma'am. I'm at Brookwood, and I'm with Precision Orthopedics, and our direct line is 978-4056.
All right, thanks so much, doctor. We appreciate
Yes,
your
ma'am.
time.
Thank you.
All right, guys, we'll come in.